Welcome to the Successful Nonprofits Podcast. I'm your host, Dolph Goldenberg. And today, we are going to be bringing you an incredible conversation with TJ Muehleman about avoiding the pitfalls of messy data. Before we bring that to you, though, and before I introduce TJ, let me just remind you that if all goes well, in just 2 days, we are going to be recording the next Ask Dolph Live. That is your opportunity to sign up, jump into a group Zoom, and ask me any question that is challenging you professionally. Or if you're on the board, challenging you as a board member. So please, if you're interested, if you want to ask a question, make sure you go to successfulnonprofits.com and sign up today. And now, it is my pleasure to introduce you to TJ Muehleman. TJ is the founder of Standard Data, which is a consulting group focused on using data to make better decisions in healthcare and public health. Now, TJ is definitely a numbers person, he's a data person, and he's also an IT person. And you see that when you look at his LinkedIn profile, you see that throughout his career. He went to Georgia Tech. He's been an engineer. He's managed software engineers. He has worked with startups that have leveraged social media and leveraged other IT opportunities for both nonprofits and for-profits. And so it's interesting because you kind of see this progression that, yes, at some point TJ was going to found his own company and would undoubtedly create something that made a really big impact. And by the way, his company's actually won some awards for the impact that they have made in the public space and in the public sector. And so the other thing I want to make sure you know about TJ, and you see this when you look at his website, and you also see this when you look at his LinkedIn profile. He has a great sense of humor. And I'm just going to give you one quick example. At his LinkedIn profile, he includes one teaching position where he notes, quote, "I also swear too much in class." And so anyone who puts that on their LinkedIn profile is someone I really want to have on the podcast. Hey, TJ, welcome to the podcast.
Good afternoon. Thanks so much for having me.
I am thrilled you're here. And I'm also grateful, TJ, because we got about 4 minutes into the recording session and realized that I had failed to hit record on my fancy software. So thank you for being willing to do a do-over here. And I've hit record and we're ready to go.
All right.
So I noticed toward the end of one of your blog posts, you compared extracting enormous value from untapped sources to an iconic line from Arrested Development. And that line is, "There's always money in the banana stand." Can you unpack that for me?
Yeah. So, one of the superpowers I think I have is translating technical concepts into sort of pop culture memes or metaphors. And so for those unfamiliar, there's this great line in Arrested Development, "There's always money in the banana stand." And throughout this series, there's this banana stand, and it's sort of poorly run. It's kind of a dumpster fire. It's got people coming and going, and they don't really know what they're doing there. And they don't really know what value this banana stand. They sell bananas by the pier or on the pier. And so as you're watching the show, you're sort of like, why does anybody care about the banana stand? And it comes to find out that George Bluth, the patriarch of the family, has literally duct taped millions or thousands of dollars inside the banana stand. And when it catches on fire, the money goes with it. And so when I wrote this blog entry, I was sort of highlighting that in my viewpoint, that we've reached this point with data that we have reams and reams of data, and we don't know what the value is in that data. And we're sort of overlooking the value of that data. And that comes in a lot of forms. And in my world, we work in public health. It's how can we use data to mitigate the severity of disease? How can we use data to understand where disease is going to happen, and how do we use data to know where to send medicine to help children live long, productive lives? So I kind of tied this very serious subject of public health to a really goofy television show to kind of highlight there's always money in the banana stand. There's always value in data. How do you use that data to exact good change?
So what are some of the common ways that organizations will just have that data lying around that they're not using? Like, can you describe what some of that data might be?
Yeah, I mean, it's everything, right? In our world, we work primarily in low and middle income countries. So that's South Americans, Africa, and South Asia. These organizations have spreadsheets full of data around, population figures and demographic data and surveillance data around where has disease popped up in the past and what medicines may have been deployed in previous drug administration platforms. So they're not necessarily using that data to actually understand where to go next. They've just collected it and now it's just sitting on somebody's laptop. And so we see that as an opportunity to kind of extract that data, put it into a data system and start to answer questions about what might be happening next and how do we better understand the nature of disease.
Got it. And so it's interesting when you say that. I was trying to think some of the organizations that I'm familiar with, what might be some of the data that they have lying around that they're not using. And so I hear you 100%. It could maybe be something as simple as like area codes of phone numbers that are calling you if you're a regional or national organization, and just so you can like data mine that a little bit.
Yeah. And it's also, who in the context of nonprofits, it's who are your donors? What do you know about them? Who do they know? And, most of the organizations we work with are sort of global health nonprofits, but we have a variety of other mission-based nonprofits. And one of the things we've helped them do is understand their impact. Because, for example, a lot of nonprofits that we've worked with, and as you mentioned in the intro, I've spent a good portion of my career working with nonprofits and helping nonprofits make sense of data. And one thing that we've noticed is that they have really wonderful missions, but I'll come to them and say, okay, what is your goal with data? What are you trying to do? And they'll tell me 75 things. And I'm like, okay, we gotta whittle that down. We gotta streamline those goals to maybe 3 or 4. And we worked with this organization that works in Rwanda, for example, and we helped them kind of more succinctly describe what their goals were. And their goals were to help women coffee farmers farm more coffee or get a higher yield from their coffee so they can make more money. And so once they kind of described that sort of overarching mission, we said, okay, well, first thing you got to understand is like, how much money are they making now? And then at the end of the program, how much money are they making at the end? Like simple stuff. And they were like, oh my gosh, that's really easy to track. And okay, so they're making 10,000 Rwandan shillings and then they're making 20,000. So there's 100% increase. So it's little simple stuff like that. And you start doing that, that you can actually start to measure impact and measure what is working and what's not working.
I love that you say that. So often when I'm talking with boards around strategic planning, what they'll ask for is like a KPI dashboard that has 75 different metrics on it. And I will so often say, you're the board. Perhaps management needs to have their eye on that large number of metrics, though probably not. What you all need are like 4 to 6 key metrics that that if those metrics are being achieved, probably a lot of the other metrics that are important to you are being achieved as well. And you keep your eye on those.
That's exactly right. And, we've now worked with some of the largest nonprofits or NGOs in the world. WHO is a client, CDC, ministries of health throughout Africa. And then some of the smallest ones where their operating budgets, 500,000 to $1 million. And what we've kind of figured out is that all of them have the same problem that you just described, where they're like, we want to see all the things. And our advice is actually very similar to yours. Is like, look, there's people who are in charge of understanding the minutia. Let them be in charge of it. But you at the stakeholder level need to kind of distill down some high level goals, some pillars. And to that end, we've kind of created this thing called the data experience framework, which we won't get into now, but this concept of understanding what is it you're trying to accomplish, your high-level goals, where do you get that data, how do you get that data, and then what are the pictures you want to paint with that data. And this is four buckets that we've kind of created. And we kind of bring that to our nonprofits because we're a software company, but because we've done this for so long and because we've worked with so many nonprofits, we've seen common themes, and applying this framework has helped people kind of think more simply about their data.
Got it. I'm going to ping off another one of your blog posts because you also talk about the importance of collecting clean data from the start. So, so you identify those few metrics you're going to collect data on, but then actually making sure that the data that you collect is clean and accurate. Can you talk about that?
Yeah. So I'll give you kind of a real specific use case. So we have a client in Haiti, and they're doing super cool work. So what they're doing is they have in Haiti this concept of a matrone is what they call it, and it's similar to like a doula or a midwife for childbirth. And they've been tracking them for like 4 years in Excel spreadsheets, the birth statistics, and they have all these sort of indicators. So how was the birth? Did the mother wash her hands at the end of the childbirth? And a whole bunch of different things that would be kind of common to anybody who's been in a room when a baby's born. And the way they're collecting their data is they're just typing it all in. So they would type in TJ Muehleman, and they might type in Dolph, and they might type in Nora. And every spelling was subtly different because Muehleman, like hell, I can't spell Muehleman right half the time, my last name. And so, imagine somebody else they're typing in. So what you ended up with was 3 years of data of these matrones, and the spellings were all over the map. And you have maps, physical locations of where the childbirths were done. And they were just typing in, I did the childbirth in Lawrenceville, Georgia, or in Bothell, Washington. And they would misspell things. And it's these common little simple things that make trending and creating sort of data, meaningful data analysis really difficult. You have to go in and clean that data. You have to standardize the spelling of names. You have to standardize the spelling of locations. And so one of the things that we've helped kind of our nonprofits and NGOs do is think more ahead of time of like, what kind of data are you collecting and can we standardize it? We're all about standardizing and making things really simple, templatized, and sort of out of the box. And because when somebody's collecting data in the field, the more they have to think, the less likely you are to have clean data. So we want to make it really simple, picking things as opposed to typing things in, radio buttons and checkboxes and all that kind of nerdy stuff that isn't relevant for this conversation. But getting that clean data means your speed to making decisions with that data goes way up.
And so part of what I think I also hear you saying then is having that validation on the back end. So like those drop downs so one person can't do ST period and someone else spell out street.
That's exactly right. And you're exactly right. So it's validation both on the back end and the front end though. So it's literally like when they're in our app, it kind of guardrails them a little bit. So that's really on the front end, but on the back end, most of our clients they pay us to help them identify outliers, identify problematic data, because when you're talking about some of these like WHO programs where they're working in 50 some odd countries, or COVID, we do a lot of COVID work. We're talking about massive amounts of scale. You got to catch that data both on the front end when you can, but then on the back end too.
Mm-hmm. Which is I think really kind of that, which I also going to steal from your blog post. So I'm not coming up with this one on my own, listeners, is review for accuracy then as you go. So like collect data for a short period of time and then stop and look at the data and go, okay, how accurate is the data we're collecting?
Man, I can't tell you how important that is because, and that's something that's part of our sort of data experience framework is constant improvement of your data. And that's, I think, one thing that the digital, I'm saying this as if it's new and it's not, but the digital transformation has brought us is the ability to be more proactive and to be a little bit more expedient with making changes. So for example, Ebola breaks out in the Democratic Republic of Congo in 2008. And they're doing a lot of data collection on paper. And so they've printed out the questions they want people to ask. They've distribute that. And then what if they discover that there's a question they want to add or they want to change the nature of a question? Well, they have to print all that stuff back up and send it back out. Holy crap, that's time consuming. And then on the back end, aggregating that data, you have to have people typing it into a spreadsheet. The digital transformation, and I say that, again, here in North America, the digital transformation happened 15 years ago, but in low and middle income countries, it's still happening. And so the ability to kind of rapidly assess what's happening and make changes to the surveys they're doing, make changes to where they're sending medicine, make changes to what they're doing is because the data is flowing in real time and they can be more responsive. And doing that, as you mentioned, sort of it's daily, really checking the data.
Where I'm going to push back just a little bit, and I agree on the whole, the digital transformation has happened in America, but especially in two key areas. One, small and medium-sized nonprofits, and also rural areas throughout the United States. I don't know that the digital transformation has fully happened. And so, like, as an example, I've stepped into some organizations as a consultant, and they're still collecting paper forms, whether that's on clients or volunteers or donors. Like, literally, they're still collecting paper forms. And that data either does not make it into any sort of a database or even, frankly, a spreadsheet. Or if it does, then you've got all of those data entry errors that we were just talking about.
No, and you're spot on. I'll tell this slight story to kind of confirm what you just said. When the vaccines the COVID vaccines were first rolling out here in the U.S., so this would have been February, March of last year, we predicted that one of the biggest challenges was going to be deploying it to rural counties. And, people were, I think, enthusiastic about the vaccine distribution. And I think I was enthusiastic about it too. I was like, finally the vaccine's here. But the reality is that rural America resembles in a lot of ways the low and middle income countries that we work in. And I say that not a negative, I don't say that condescendingly. It simply reflects the reality that broadband isn't as available. Internet connection overall isn't as available. Cellular connectivity isn't that great. And other resources aren't as prevalent as they are in metro and urban areas. And so because of that, you're spot on, and especially in healthcare. I've had the good fortune of spending a lot of time in Africa and spending a lot of time in ministries of health on the ground in Africa. And I've seen firsthand how they're sort of leapfrogging us in a lot of countries, leapfrogging the U.S. in terms of their healthcare systems, in terms of the way they use technology. And I think we're so mired in, this is a conversation for another podcast, but we're so mired in the politics of it all that we can't decide what to do. And it's a little frustrating for somebody like me who deploys technology around the world that we can't deploy here.
So what are the low-hanging fruit for maybe some of those smaller and medium-sized organizations, ways that, if they were to collect the data differently, they would be able to analyze the data?
So I think it's understanding what tools are at your disposal, right? There's Excel spreadsheets. My goal is to replace spreadsheets in a lot of ways, but that will never happen. And so I know that will never happen. But moving from paper forms, moving from using non-structured data inputs like Google Docs and Microsoft Word. I mean, I'll tell you this story. The World Health Organization, for their measles program, still collects a lot of data in Microsoft Word. So for the small nonprofits out there who are like, I don't know what to do, you're not alone. Even the biggest, most massive organizations in the world with multi-million dollar IT budgets still use the wrong things to collect data.
That's really surprising. I just have to say that they're still collecting some data in Word. Genuinely surprises
absolutely.
me. Wow.
Yeah, it kind of disturbs me. But at the same time, a lot of the data that they're collecting, is sort of quantitative and some of it's qualitative. And so some of the data is easy to collect in Word because you're like, how did the patient feel today? And that's not the easiest thing to put into Excel. And so I get why they're doing it, but it just makes data analysis so hard. So again, practically for the nonprofits out there, it's move to a more structured data collection tool. Again, Excel or standard data, what we do, we provide to our clients, or Typeform or SurveyMonkey. Those tools are great for structuring your data and making it a little bit more digestible.
And I will say part of me is pained when I hear you say that you hope one day to do away with Excel, because I am an Excel junkie, like literally an Excel junkie.
So I am too. So let me be clear about that. And actually, in total transparency, my wife works at Microsoft and I'm a Google Sheets junkie. And so I don't tell her that. But so I am too. I am a big believer that Google Sheets or Microsoft Excel or whatever it is, or Airtable is a big popular one now. Those are wonderful for data analysis. But what we're frequently seeing is that they're not used for data analysis, they're used for data ingestion. They're used for collecting data. Mm-hmm. And so if you're going to use any off-the-shelf tool, use Excel, great, please use it. Don't use Word or Google Docs. But ultimately, what I want to see are tools like ours that sort of take the data from an iPhone or a Google or an Android or your desktop and immediately put it into a database where that data system can exact some rules upon it and can automatically put it on a map or do some trend analysis on it. So that's really what I'm getting at. I don't want to get rid of Excel. I just want to get rid of it as the data collection tool.
Thank goodness. And I will say, you all have developed some very cool interactive real-time maps, like having spent some time at your website, whether it's COVID vaccination in terms of number of people vaccinated versus total number of shots made available. But it's real time. It's really cool the way you've created a system that literally Gets updated every day.
Yeah, every night at 9 p.m. And I think that's really what we do. And it's really interesting because in the private sector, outside of either consumer health or global health, you see the kinds of things we do are commonplace. Automated data routines, automated building of maps and dashboards. But inside healthcare, what we do is still really novel, and it's really kind of makes me scratch my head a little bit. But yeah, that's what we've spent our whole kind of the lifespan of our company doing, is sort of how do we take the banana stand, right, and take that data or those bananas and make some really delicious banana pudding out of it, and that's the goal.
Well, and I will say, like, that's one of the things I think you all are succeeding at so well, because again, having looked at some of the charts and graphs and dashboards that you all have produced, it's very digestible. So even in cases when, for example, the county level data on COVID vaccination and total number of shots, provided to each county, that's thousands of data points. But yet it's so easily digestible that you can look at it for 5 minutes and get a real sense.
I totally agree. And I'm glad you noticed that. One thing, when we built the COVID mapping project, it was a direct response to the epidemiologists, which I'm surrounded by epidemiologists every day. And I'm always the dumbest person in the room. These are folks with PhDs and master's degrees and just really bright people. But a lot of times they're used to talking to other epidemiologists. So they'll share complex visualizations that somebody else understands, but could I show it to my mom, who's not an epidemiologist, right? Who just wants to know, is COVID bad in her neighborhood? And so most of the data visualizations we build aren't really designed for epidemiologists. They're designed for the moms and dads in the world who want to understand how prevalent is COVID or what have you, whatever disease we're mapping at the time. How prevalent is it in their neighborhood? And I call it the mom test. Like, can I show something to my mom? And she's gonna be like, I totally know what that means. And we did that early on with COVID mapping project, was to show it to non-technical people. And they were all like, I totally get this. This is so helpful. Thank you. So that's our goal.
So I was just about to ask you a question. Now I feel like you've answered it, because I think the answer might be the mom test. Maybe we can dive a little deeper. So when organizations are looking at presenting data visually, so in charts, graphs, a dashboard, et cetera, to their board, maybe in their annual report, or to funders, what are some of the key things they should be thinking about so that data is easily digestible and easily accessible?
Yeah, the key is to understand your audience. If you're presenting data in an annual plan, and a lot of the data for nonprofits ultimately makes it into a final report or annual review, is to understand your audience and understand sort of what they're wanting to understand. So, for example, we work with a nonprofit out of Rwanda, who they track how people are doing, how coffee farmers are doing it throughout the program. And they have a bunch of different indicators. And so they used to just collect that data in a spreadsheet, and they would release that spreadsheet. And it was, you'd have to kind of dive in and be like, okay, it went from 22 to 32. And what is that, like a 30% increase? I don't know, 50% increase. We actually did that for them. And we created like these really nice visualizations that said 50% increase or a 20% decrease, or here's some bar charts. I think the goal has got to be understanding your user, understanding your the person who's going to be looking at the visualization, and what is it you want to communicate, and can you communicate that without having to like study it, and simplifying the data, simplifying the outputs.
I love that. And I think those are words to live by as we're taking, as you said, like reams of data and presenting them to people. Those are definitely words to live by.
Yeah, I agree.
So TJ, I'd mentioned you're going to get an off the map question, and I've got a great off the map question for you. The only thing that I don't like about this question is really, if we were just to turn the map over, this question's on the other side of the map. So it's technically not off the map. But you have created the coolest database ever. And it is called the Database of Nachos.
Yeah. Well, where do I start? So there's a funny story to this that actually relates to global health. So let me tell you. We have a client who's actually become a really close friend of mine. He comes to me about 5 years ago and says, okay, TJ, we're plotting all of these villages in a particular part of Western Africa. And we want to be able to show them on a map, but there's so many of them that we need to be able to draw a polygon around them and show all the villages that sit inside that region. Can you do that? And I'm like, yeah, I think I can. And as you mentioned in the intro, my background is an engineer. I was an engineer years ago. And so now I try to take on one project a year to kind of keep my engineering chops fresh. I don't code on a daily basis. So I was given this challenge by this client in 2016 to create a map of villages and be able to draw a polygon and show them all. So that was the challenge. And I didn't have the data. So I was like, I need a bunch of data places and put them on a map, and I'll be able to draw a polygon around them and see what shows up. So I was like, what can I use? And I had just had the most righteous bowl of nachos or plate of nachos. And I was like, I really love nachos. Everybody talks about tacos and burritos, but nachos doesn't get enough love. And so I wrote a program that found most of the restaurants in the United States that serve nachos, which is about 29,000 restaurants in the United States.
Well, hold on, wait a minute. So I need to understand more. You wrote a program that found them. So this program crawled the web and looked at every restaurant, or what did it do?
So what it did is it crawled Yelp and Foursquare. So if you remember Foursquare, Foursquare is a very different company now, but they have menus. So I crawled Yelp and Foursquare, both of which have a lot of menu data. And so it would look for a city. So let's say Atlanta, show me all the restaurants in Atlanta, and then crawl through each restaurant and look at the menu and find instances of nachos. And so it loaded it all into a database. So 29,000 restaurants, I think 2,000 cities, all 50 states. And it kind of took on a life of its own. Like we ended up building it, and it was so much fun, and it got so much sort of positive traction. We just made a bunch of t-shirts this year for the team, sweatshirts. We have buttons, and it's an example, and it kind of goes back to, you mentioned my sense of humor. I spend a lot of time talking about very serious subjects, and I think as a society, we have spent too much time talking about our jobs and not enough time talking about what we like. What do we love to do? And I love technology, and I love using technology to, improve the human condition, as we talked about a little earlier about the Georgia Tech mission statement. I love that mission statement. How do we take data and how do we use technology to improve people's lives? Also, how do we use technology to find where nachos are? It's possible. Those aren't mutually exclusive loves. And I think we look at people with senses of humor as if they're not serious. And I'm like, I'm real serious. I'm deadly serious. I've flown all over the world. I have been in the worst hotels. I have eaten the dankest food. I have done wild things to help improve the human condition, but I also love to have a good time and be a little bit whimsical and fun. And it lets me sort of offsets some of the seriousness of knowing that there are people dying of COVID or whatever. And it kind of helps, keep me going. So that's where the database of nachos comes from.
I really love the database of nachos. And listeners, just so you know, that acronym is DON, D-O-N. So the database does have a name, I think. And also just have to say, like you, I love nachos. I'm based out of Georgia, so I was thrilled to see that 1 out of every 25 restaurants serving nachos in the U.S. is in my state, which means I'm overly represented in the nacho community. So I was very, very happy about that. Although disappointed that I don't live in Chicago, because A is an awesome city, and apparently, if you like nachos, that's the place
it is.
To live.
And I'm gonna turn around the question. I'm gonna ask you a question. Do you put olives on your nachos?
Oh, I get everything they will put on there. I want olives. I want fresh jalapenos. I want pickled jalapenos. Everything they'll put on there.
I like most of that answer, but we don't acknowledge olives on nachos.
That's awesome. That's awesome. Well, admittedly, my husband's not a huge olive fan, so if I'm doing it by myself, I will. But if I'm with him, we'll do it without the olives. Yeah, and I get that it might not be as traditional, but I'm like, hey, it's really good. But again, I loved that project.
Good. Thank you,
TJ. Thank you, and thank you for sharing so much great information about both how to collect data, how to display data, and of course, the database of nachos. And listeners, we're going to link to that in the show notes separately, just so you can check out what the nacho scene is like in your town or your state. The other place that you should absolutely go is standardco.de. That's standardco.de. And that obviously is TJ's company's website, Standard Data. And when you go there, there's a couple things I want you to look for. The first is they have lots of case studies on ways they've helped other nonprofits. And I just have to share with you that by reading those case studies, you will get ideas about ways that you could be better using the data you're already collecting, better collect the data that you're already collecting, and frankly, better really display it and interpret it for folks. The second thing that I also really want you to check out is to spend some time on their resources page. They've got some great resources that will absolutely benefit you. Hey, TJ, thank you so much for coming on the podcast.
Thank you so much for having me. This is wonderful.
Listeners, I am so glad that you've joined us today for this conversation with TJ. And if you found it useful, if you have gained some insight that's going to help you better collect or use your data, then there's 2 other episodes that I would like to suggest you listen to. The first is Charities Who Love Charts with Tracy Stanley and Joshua Folker. That was episode 133. And the second is episode 192, Measuring Impact with Alan Mackey. And also, if you found this episode useful and you think someone else in your organization or a colleague at another organization would find it useful, hey, you probably got your phone out, so go ahead and text this podcast episode to that person so that they can benefit from it as well. Listeners, that is our show for this week. I hope that you have gained some insight to help your nonprofit thrive in a competitive environment. And I say it every time because the lawyers make me say it. I'm not an accountant nor an attorney. And so obviously that means neither I nor the Goldenberg Group are providing tax, legal, or accounting advice. And so, the lawyers also make me say this part, but it feels pretty obvious after I just said what I did. This podcast is for informational purposes only and should not be relied on tax, legal, and accounting advice. If you find yourself in need of that type of professional counsel, please find a licensed, qualified person who specializes in the area that you need assistance in and get their advice. If you're not sure who to reach out to, you can always reach out to me, and I am happy to try to make a connection with the right person.